Alright, so I'm gonna show this surgical method. A few people have been asking me, and it's something you really have to see. Excuse me, so I'm gonna show it off here, and how you do it. Excuse me, I am kind of sick right now. I had an op fall through, so I'll just go ahead and do this. On my server, anyway, I don't generally have to shoot people to get surgical fractures. Our chances are kind of high. But depending on your server settings, I recommend shooting people with the Glock handguns. That can also work, like small caliber handguns anyway. I'll show the server settings at the end, but we have things like coag turned off. That's going to get fixed later. And we also have kidney failure off. It's pretty weird settings, and they get fucked up by the mission all the time. But overall, I think it's fairly comparable. The only thing that you need for this to work with your server is the unconscious requirement. If you have the unconscious requirement, then you're set. All I'm really going to do with this guy is give him TXA, and then I'll just clot him out. I'm going to monitor him, do his airways and stuff. I'm going to get him awake and conscious like any person you have in the field. And then, oh, there we go. And then, I'll give it a bit of time. I'll kill the video. We'll wait a handful of minutes like you would if you were going to medvac or drive someone to a MASH or whatever the case is, right? You wouldn't immediately do the surgery on a casualty. Usually, that's very rare. So I'm going to smash this guy up with fluid. I'm going to do everything. I'm going to give him painkillers, the Tylenol, like you would anyone else. And then after quite a bit of time, we'll take him over to the MASH. Okay, so I'll let him screw around for a bit. And he's all better. Here's his triage card. Pretty standard care. Stopped his bleeding, fixed his airway, gave him painkillers, gave him splints for the pain just to kind of stabilize him out. He has a surgical fracture and a bunch of non-surgical fractures. In my experience, most servers you can fix the simple fractures in the field. I'm not going to do that now because it'll jump his heart rate. But yeah, we'll just do his surgical. Anyway, so I'll show you how you do this if you don't mind waiting. Okay, so you're going to take your blood draw. Blood draws are better. You can just shoot people. Blood draws are nicer because you can give the fluid back to the person. They also don't take that much space in your kit. I recommend you carry them anyway because you can pull them out of dead people. Especially if the AI death threshold is higher than for players. You can find dead AI who still have more than 3.6 liters of blood in them, and you can pull it out. And I wouldn't be concerned about blood groups too much. You can check. You should check. But the reality of the situation is that the vast majority of AI and players are O negative. Vast majority. So you don't have to worry too much about blood inconsistencies and not being transferable patient to patient. It generally works. And like I said, I guess I haven't said it in this video. I've said this to a lot of other units and a lot of other medics. Wrong blood group transfusions are really not that bad. The CAT Discord recommends you give people painkillers. I've always just waited for the heart attack and then defibbed or CPR'd. It's really not that hard to get people back from those conditions. It's really not that bad. So if you need to give people fluid, it's not a bad way to do it. in spite of the heart attack. Anyway, okay, so here we go. We've taken 1 full liter out of a patient. Um, every 20 points systolic indicates 500 milliliters of blood loss. So what I'm going to do now is I'm going to give him morphine. Morphine's preferable to fentanyl simply because it has the highest heart rate decrease in any range, whether it's high or normal heart rate increase. If you check the coding, you'll see that. But anyway, I want to tank this guy's heart rate down to about 60, and I want his BP as low as I can get it. And I want his BP as low as I can get it because typically speaking, people in surgical failure will crash out on the diastolic 190 and not the heart rate. So that's a great heart rate. He's not going to die from that. We checked his triage card before we started. There's no other medications that are going to drop it any more than that, right? And the BP being low, we don't care at all. The only thing we care about is his heart rate. His heart rate's brought him down, his BP's down, so we'll go ahead and I'll just do the incision. You're going to probably notice at some point here you're not going to be able to read his vitals, so I'll just manually check them here so that you get the pop-up over here. Just wait a second. That's a high heart rate and a high BP, but he's not going to die. It'll climb and it'll climb and it'll climb and it'll climb, but he will never crash. And he can stay like this forever. In fact, if you want, I can even like just stand back and watch him. But he can stay like this forever. It's not a problem. And he'll go high and he'll go low. The other thing to mention too, this might just be a personal thing. I've only really tested this on 2 servers, but the morphine auto-injector lasts for 30 minutes. I've given people surgical failure and left them for more than 30 minutes, and seemingly there's no adverse effect. I'm not sure what that is. Okay, what's his highest BP here? 150, 135. Okay, so yeah, his BP is going nowhere near the diastolic range, and his heart rate is also nowhere near. It'll get up to about 210, 205 sometimes, but it's not going to kill him. Excuse me. Anyway, if you have a patient with more than one surgical failure, don't perform the incision on more than one of them, excuse me. You will screw them up. It will kill them. So do them one at a time and give yourself periods between between the fractures. I forget what kind it was. Pretty sure it's comminuted. It really doesn't matter either way because he's in surgical failure right now. So we could do this wrong a million ways to Sunday and it won't kill him. That's the other benefit to this. If you get the orientation wrong, you'll still be okay. Whereas with the standard surgical procedure, you have to know the methodology like right going in because the etomidate only works for 30 seconds or so. There we go. Done. And now we'll watch. Actually, I'll give him naloxone. Sorry. There we go. There's the naloxone. And he should just go back to normal. His heart rate's really high right now, but like I said, you kind of have to give them a second for their heart rates to stabilize out of surgical failure. There's a lot of weird things that happen when they're in this state, so giving them just a little bit of time is very smart. I would not jump one surgical fracture to another. But yeah, anyway. Now once you got them like this, you just hang the blood back. AB positive is not that. That's a crap bag. And again, A neg is a pretty bad blood group. You can't give it to, I think it's less than 50% of people, but it really doesn't matter because if you give bad transfusions to people, just wait for the heart attack and defib them. It's not that hard at Okay, we got him here. I'm going to smash him with some nitro to get him up there. And his heart rate should stabilize out pretty good. So yeah, this takes considerably longer than the standard method for surgery, but it also works a lot better. Ooh. And if you can't see the heart rate, for whatever reason, my Potato PC and screen recorder can't watch the heart rates very well, so here you go. And his blood pressure is only low now because of the nitro. He's obviously not in blood loss. That's just nitroglycerin, and that'll go away after 6 minutes. But anyway, that's how you do surge to patients without knocking them out. You can do this a lot more safely than with standard, and I highly recommend it in place. One last thing, if you care at all, I'll just show the surgical settings. And the only important one is the unconscious requirement. If you have this turned on, you can't do this. Aside from that, it's fine. We have ours set up kind of funny. Our pharmacy is even, everything's kind of set kind of funny here, but that's alright. That's just because stuff gets overloaded by the mission file sometimes, as annoying as that is. But, you know, is what it is. Anyway. Enjoy.